The best areas of the body for liposuction are areas that are disproportionate with surrounding areas. In other words, if someone is fat all over, if someone comes in and says, take the fat away here, 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 and they're pointing all over their body, that's not really a liposuction patient. Liposuction patient usually can point to 1, 2, or 3, maybe 4, but usually 1, 2, or 3 areas of the body that are thicker than they should be. They're disproportionate, disharmonious with the rest of the body. Having said that, there are certain of these areas that look better, that fare better with liposuction than others. By far the best is what I call the hips, or the low back, the waist, the love handle, the muffin top. Just around your love handle, above your butt in the back. That fat is a really thick fat, and the skin there has a tremendous ability to tighten down. So we can remove large amounts of fat in that area and achieve a tremendous result. Patients come in all the time thinking that it's their tummy. They want their waist narrower, so they ask for their tummy. Sometimes there is extra fat in the tummy and we do it, but there's usually less extra fat in the tummy than most patients think, and they can achieve far more with the low back, love handle, waist area. Not only is there more to remove in the waist area, but that skin there tightens much better than the tummy skin tightens, so for that reason, that's a great area. Another great area for liposuction is under the chin. If someone has a true double chin with good quality skin, who's not showing muscle banding, liposuction works terrific there. But I see a lot of patients who've had liposuction in this area that probably shouldn't have had liposuction there. They may be women or men in their 40s or 50s, and sometimes there are women in their 40s and 50s who do well with liposuction here. But I see a lot of people who've had suction here, and all they've done is remove that layer of fat that was covering over the muscles. And though they look a little thinner, they can actually look older. So what I'm saying is this is a great area, but you really have to select the patient well. The upper arms work great for liposuction. It won't make someone with huge arms skinny, but it works wonders to make the arms thinner and to sculpt them. It's also important to look at the skin quality in the arms. If someone already has loose skin that's flapping around, liposuction alone is not really going to be the solution because it doesn't tighten the skin. To do that, you'd need to have some kind of a scar to remove and tighten skin. The breast is a great area for liposuction in both men and women. In men, it's called gynecomastia, where they have some breast development, and liposuction can work wonders to thinning that area out. And for women, liposuction is a great way, a great tool to perform breast reduction. If a breast is also droopy or the skin is loose, then they need to have scars to tighten up. But if everything is high, tight, and full, then liposuction of the breast is fantastic. The tummy, the abdomen, is a commonly performed area for liposuction. It's not one of the best areas for liposuction, though. For reasons that aren't entirely understood, that area has a real tendency to crepiness. Think about yourself or friends you know that when you sit down and you look at your tummy, there's a tendency, even in thin people, for the skin to be a little loose and there to be just a little bit of scalloping and cellulite appearance. So while it can work great in the tummy, I think it's more frequently done too aggressively on the tummy, and the tummy should be done with a little bit more conservative of an approach. The thighs are, of course, also great. The inner thigh, if there's a real discrete bulge, removing that can improve the contour there. And what's more is if you remove the inner thigh bulge, you reduce the whole diameter, the whole circumference of the thigh, so that you have less pulling of fabric on the outer thigh. Right? If your pants are pulling or your skirt's pulling on the outer thigh, and you remove a little on the inner thigh, well, not the skirt, but with pants, if you remove a little on the inner thigh, then you loosen up the whole pant and it drapes better on the outer thigh. The outer thigh is also a terrific area for liposuction. I've seen it overdone. There are so many patients who want every drop of fat taken out, and the plastic surgeon just obeys their wishes and takes out everything he or she can, and then they look flat along the sides. That doesn't look beautiful and it doesn't look feminine. It needs to be done harmoniously to create a nice and beautiful sculpt. Another area that we frequently perform is the inner knees. A lot of women just have little knobs in their inner knees, and it's amazing how a small amount of liposuction there can work wonders. I also do liposuction on the ankles. People call them cankles, where their calves just go straight down to their ankles. This is a fantastic area for liposuction, but we really have to be careful because in that area, people can have swelling that lasts months after surgery. It's a slow area to heal, and it's also an area that's prone to get some irregularities. So if we put all of this together, the low back love handle area is the best. Outer thigh is great. This area is great if necessary. Arms are great. Chest is great. Tummy, good, but we need to be careful about it. So the important thing for you if you're considering liposuction is to understand that some assessment needs to be made of your overall proportion, and then the quality of the skin in the thick areas, the amount of fat to be removed, and if it's done right, you can have a fantastic improvement in your overall proportions.